Madhu,
It is
ma'am.
already
Good
2:32. We can start the
afternoon, good
session.
afternoon, everyone. Elizabeth, ma'am.
Good afternoon, Madhu ma'am.
Yeah.
Good afternoon, Shaya. God bless you.
Thank you, ma'am.
Dr. Gunjan, we can start the session because it is already 2:32. We have to be in the time.
Yes, ma'am. Good afternoon, everyone. I am Dr. Gunjan Baveja and Secretary AOP Chandigarh. We wouldn't change him for the world, but we would like to change the world for him. So that small quote I would like to start the session with, and that's a positive note. Before starting anyone, I would want to invite Dr. Sangeeta ma'am, Sangeeta Lodha ma'am. She is Chairperson Women's Pediatric Forum for a formal welcome. Welcome, ma'am.
Good afternoon, everyone. I, Dr. Sangeeta Lodha, Chairperson, Women Pediatricians Forum, welcome you all to the webinar, which is a curtain-raiser webinar on the occasion of International Down Syndrome Awareness Day, celebrated all over the world on 21st of March. The theme this year is End of Stereotype for the Children with Down Syndrome. Let's do the cognitive retraining. It is a great honor to welcome you all off the screen, on the screen, to the webinar organized by Women Pediatricians Forum. I would like to take a moment to extend my warmest greetings to each and every one of you for making the efforts to be here out of your busy schedule. I request Dr. Gunjan Baveja to please start the session and further proceedings.
Thank you.
Thank you, ma'am. Thank you. So I'll just start with a small video on Down syndrome, which is made by Dr. Chaya. So I just start that.
And Dr. Sangeeta Lodha also helped, yeah.
Just compiled and helped. So.
कुछ पाने की हो आस आस, कोई अरमा हो जो खास खास आशाएं, हर कोशिश में हो बार बार, करे दरियाओं को आर पार आशाएं, तूफानों को चीर के मंजिलों को छीन ले, आशाएं हिले दिल की, उम्मीदें हंसे दिल की, अब मुश्किल नहीं कुछ भी, नहीं कुछ भी, आशाएं हिले दिल की, उम्मीदें हंसे दिल की, अब मुश्किल नहीं कुछ भी, नहीं कुछ भी।
The video courtesy Dr. Chaya and compilation by Dr. Sangeeta. Ma'am, so after this, I'll just introduce all the speakers and the chairpersons before we start the session. And first speaker would be Dr. Kusum Kala. She's Honorary Consultant Pediatrics and Neonatology and expert in adolescents at Jaipur. And she's been a trainer of NSSK in 2013 and organized various CMs at Jaipur. And she has participated as moderator and speakers in various webinars. Our next would be Dr. Sangeeta Yadav, ma'am. I think ma'am needs no introduction. And she is presently at Department of Pediatrics, Sir Delhi. And she has been Professor of Excellence and ex-HOD, MAMC, Delhi. Ma'am has interest in vaccinology, pediatric and adolescent endocrinology, adolescent health, disaster management, infectious diseases, environmental and developmental pediatrics. Ma'am has held various posts at Central IAP, has been a guiding force for all of us, I think, and she has been awarded with various awards also. Welcome you, ma'am, to this forum. Our next speaker would be Dr. Chaya. Ma'am is again a very well-known figure in IAP, founder, clinical director, ASHA, Center for Autism and Intellectual Development Disorders. And she has again been held many posts at national and local central IAP levels. Ma'am has been Joint Secretary, Childhood Disability Group, IAP 2010 to 2014, National Secretary of IAP Neurodevelopmental Chapter, and coordinator for IAP fellowships and various other forces. She has been clinical director, developmental and behavioral pediatrician and parenting expert at ASHA, Center for Autism and Intellectual Developmental Disorder. And we welcome you, ma'am, on this forum. Our next speaker, Dr. Bindu. Ma'am is again a very senior, well-known figure of Center B. She is professor of pediatrics and neonatology, additional dean, SIMS, Government of Telangana. She is president-elect Central AHA 2024, founder chairperson AHA Hyderabad, president of Indian Academy of Pediatric Twin Cities branch 2013, and already she has held many posts at central level of IAP. She has many publications, around 65 publications in national and international journals. Welcome you, ma'am. And our next speaker, Dr. Elizabeth, ma'am, again, ma'am, UNICEF consultant, Kerala. She is former professor and HOD pediatrics and superintendent at Hospital Medical College and Kerala. State president in 2016, PASH National President IAP Nutrition 2017 and 2018. University first rank in MBBS with 3 gold medals. I think all of us have read ma'am's book, and she's author of this nutrition and child development book, chapters in textbook also of IAP. She has received many awards, Best Doctor Award, Government of Kerala 2014, Best Teacher Award, and many others. So we welcome you, ma'am, on this forum. With this, I think I will not waste much time between the sessions and the introductions. And I would like to invite our first speaker, Dr. Kusum Kala, for the case presentation. Welcome, Dr. Kusum.
Yes, just a second. Good afternoon, everyone. Thank you, Dr. Gunjan, for introducing me. And I thank from bottom of my heart to Dr. Sangeeta, ma'am, and Dr. Chaya for giving me this opportunity to participate in this beautiful activity. And of course, my mentor at Jaipur is Dr. Madhu Raturi, ma'am. And we will start with the case. As we all know, we have organized this webinar on occasion of World Down Syndrome Awareness Day, which will be on 21st of March, that is tomorrow. So the case is related to one 14-year-old boy, Aryan, who visited our OPD. He was first in birth order, born of non-consanguineous marriage, and mother's age during his birth was 35 years. He was known case of Down syndrome. He was diagnosed at birth, and rather he was diagnosed during antenatal period. But still mother wanted to continue the pregnancy, so he was born. And the karyotype picture is shown here. It is showing very clearly there is extra 21 chromosome, that is trisomy 21. He presented with behavioral issues, including stubbornness, non-compliance. He never used to listen to anybody, even his mother. He used to have anger bursts, temper tantrums. He lost all interest in his studies. He used to get frustrated very easily. He was very aggressive. Even he used to show some violence against his friends, which he never used to do before 2-3 years. And he always preferred to stay alone because he was not compatible with other people. And although the development was delayed, and he used to speak only few words, but with those few words also he used to shout at his mother. As I mentioned, there was global developmental delay. Although he was manageable with some remedial interventions and support, so he was sent to mainstream school. But till 6th standard, with all these support and measures, the things were going well. But after he was 12 years old, things started to worsen, and he started having behavioral issues. He was diagnosed during the antenatal period by all the relevant investigations, which included the serum markers, the USG findings, and during 16-17 weeks by amniocentesis, the karyotyping was also done with the picture I showed. Mother was informed on time that there is time that she may or may not continue the pregnancy, but she opted to continue, and she decided to give birth to this child. So when we had this child in our adolescent in our OPD, so when further probing was done by taking further history and developmental and academic assessment was done, IQ was assessed by special this Down syndrome IQ charts, and he was referred to clinical psychologist, and we took help of psychiatrist also. IQ came to around 70. 65-70 was the IQ. Psychological evaluation was carried out. Counseling sessions were arranged. The evaluation and counseling sessions revealed that he was being bullied in the school. His friend Vihan used to call him names, used to pull his hair, and some other boys used to make fun of his looks. That resulted in anger, frustration, and all those problems which I mentioned in the second slide. He had no friends. Unfortunately, there was no support from teachers regarding this matter. So how we managed this child? Counseling sessions were carried out not only for Rohan, but for his parents also. Activities were carried out to improve his emotional abilities. His life skill training was done. Psychological evaluation was done. Even functional behavior analysis was done to find out that what is the reason of this behavior other than bullying. Various tests, the screening tools were used for anxiety like SCARED and BDI for depression, and it was found that he was suffering from aggressiveness and mild anxiety, rather I should say mild to moderate generalized anxiety disorder. On examination, I didn't mention in the slides, on examination or systemic examination was okay. He was anemic on general examination, and there was history that during the infancy, he was diagnosed, he was having a small congenital heart disease, VSD, but no operation was required. It closed on its own spontaneously at around 1.5 to 2 years of age. So now we had to treat anemia. For that, iron supplementation was done as per the guidelines by RKSK, Rashtriya Kishore Swasthya Karyakram. 60 milligram per day tablet was given for 3 months. And so combination of iron supplementation, life skill training, and counseling helped this child to come out of this situation. And of course, we took help of clinical psychologist and the behavior therapist. So that was all about this case. Thank you so much.
Yeah, thank you. Thank you, Dr. Kusum. I think
I can
Gunjan's
stop
phone.
sharing.
Yeah, I think Gunjan's phone has just got disconnected. She'll be joining in a while. Yeah. Dr. Sangeeta Lodha, you can take over till Dr. Gunjan joins. Yeah.
No.
You're mute, yeah.
Now I request anything, anybody want to just discuss about this case? Any specific presentation in this case? Any outcome?
So,
Otherwise, I will.
Sangeeta ji, I think Dr. Hima Bindu has to attend a meeting.
Okay, okay.
We will let her speak and then I think we'll take the
Okay, no
question.
problem.
The only thing which I'll just take
ma'am.
half a minute.
Yes, ma'am.
I think in this the case, the highlighting factors are, one is it's an adolescent, another is it's a violent and an aggressive adolescent, and the self-esteem has taken a little beating because he's being bullied. So all these are the issues which need to be addressed when we are addressing the adolescent issues related to the Down syndrome. So these are the things which actually we should focus on in relation to this child. I just wanted to highlight that. Thank
Thank
you.
you, ma'am. Very well said that. I request Dr. Hima Bindu Singh, our past chairperson of Women Pediatricians Forum, for further proceeding.
Thank you, Dr. Sangeeta. Warm greetings to all of you. Nice to see Dr. Sangeeta Yadav, Madam, chairing the session. Namaste, Madam. And
Namaste.
Dr. Chaya, our colleague, both of us working for this Downs. And nice to see Kausam Kela presenting a case on this. So while welcoming all the seniors and colleagues to this very important program, and this is something being highlighted because we are celebrating the Downs Day. Though it is tomorrow, the curtain raiser by the WPF is today. And such programs, I think, will sensitize more, the pediatricians, especially because we deal with children, and the specially able children are all we are seeing in day-to-day in our OPDs and IPDs. So it's very important that we deal with them with respect and with a proper dignity. So I think it's very important that these sessions should be conducted, and therefore we know how to deal with it. Dr. Chaya is an expert in this area, and she'll be talking a little later after me. And I would like to just, share a few words of how to, ethically deal with these children. So ethics in disability, that is the topic given to me. Now I would like to share the screen. There are a few points, though I did not get time to refine it, but I think this will be helpful. Share You're able to see the screen? Yeah?
Yes, we can see.
Yes.
Yes, ma'am, it is visible. Can you
Yes,
make it
large.
full screen, please?
Full screen.
Can you make it full screen, please?
Full screen.
Click on the slideshow and start from beginning. Just click on the slideshow link. It is in a horizontal menu, ma'am, to the slideshow.
शुरू कम दिया करो 7, 4.
Madam, come to the slideshow mode. Just see the lower down part, red.
Ma'am, either it is,
It's okay.
yes, it's coming. Yes.
Yeah.
Yes, what's working, ma'am? Thank you.
Yeah.
Please start.
Yeah. Just a minute. Yeah. So basically, so ethics are very, very important because we hardly talk about ethics when as pediatricians. It's very important that we have to deal with these children. They are specially abled, but we need not discriminate them. They are just another creation of God, another creation of life. So they also have all these children who are little different, maybe little normal. They are another variants of children, and they should be seen as normal as possible. And there are ethics involved in dealing with these children. So let us get sensitized about this topic. So what is ethics? And this is nothing but, respecting them, respecting any individual for that reason. And all children also are entitled. It is their right to be dealt with dignity. To have, we have to look at them as individuals with freedom. They have to make their own choices. And the independence of every person is so important, including children. So they need to be participatory. We are inclusive. We are talking about inclusion. every in this WPF right from March. So we have to be inclusive about these children too, and respect for their difference and accept them. Whatever disabilities they have, it is only a human diversity, and therefore we need to accept them as normal human beings. We should also follow certain etiquette, a set of guidelines while dealing with these children, and we should approach them. Though there's not much consensus about this, but in 1970s, a consensus has been developed to treat them with dignity and respect. And this is involving all children with disabilities. Like, the way we talk to them, pediatricians, when we talk to these children, in fact, when we see them, we don't even recognize them that they are individuals. We keep talking to the parents, and sometimes we don't even identify them, that we assume, we become judgmental, and we assume that they have low IQ and they may not talk, or they may not know or understand what we're saying. So we should not be labeling the child or judging the child as a disabled child. We have to speak to the person or the child directly, and not to the person who's accompanying the parents or the guardians. So we should make them feel, yes, I'm also getting the attention of my doctor. The pediatrician should never assume that they cannot speak or cannot do certain activities. Very, very important. We have to acknowledge them, respect them for whatever abilities they have and whatever decisions they are taking. And we should not become judgmental. And always use, the people's first language. For example, people with disabilities, use the term people with disabilities instead of saying they are disabled or handicapped. This is very important. So we have to just say, this is a child with a certain disability. Don't say it's a disabled child. So avoid labeling them, and avoid, saying that she is an epileptic. And for example, do not say that. But instead of that, say she has epilepsy. We are not saying there's anything wrong with her. She has epilepsy, but please do not say she's an epileptic. So this is a difference. The way we talk to them, this makes a difference. We have to learn and relearn, and we have to sensitize our pediatric colleagues to deal with these children with respect. Do not say wheelchair bound or confined to a wheelchair. Most wheelchair users perceive the wheelchair as liberating or not confining. In fact, for them, it is not confined. We are confined to wheelchair. In fact, they feel they got a lot of freedom because of that wheelchair. So do say she uses a wheelchair. It is as simple as that. Say she uses a wheelchair rather than saying she's wheelchair bound. So be very careful. Do not use negative terms or terms which are demeaning or outdated, like crippled, deaf and dumb, retarded. They're all very, very negative terms. We have to be very cautious and do not use these terms. They are very sensitive. And anybody, even including you and me, if somebody talks about such terms are used for us, we'll definitely feel bad. So empathize with these children or their parents and their families. They also have rights. It's not just about dignity. It's not about being non-judgmental. It's not about respecting them and treating them as equals, choosing the right words, but it is a rights issue. It's the rights of the child. It's a right for equality, dignity, and respect. As per Section 3(1) of the RPWD Act, it is required that everyone, including the government or the non-government pediatricians, will ensure that persons with disabilities enjoy the right to equality, life with dignity and respect for his or her integrity equally with others. This is a rights issue. So we have to be mindful of this. And there are certain guidelines. Disability ethic guidelines are laid down from 1970s. These have been refining. And these guidelines are actually, very simple. They just say, do not assume that this child may be retarded, or any Down's child, or anybody with abnormal maybe feature, so-called abnormal. For us, that looks abnormal, but it could be a variant. Why don't we accept this another variation of a creation of life? So we do not assume that this child may be retarded also. The IQ may be excellent, and pediatricians sometimes may feel that his IQ may be low as a retarded child. They don't even acknowledge his presence in the room, in the OPD or IPD, and they keep talking to the parents and they ignore the child's presence completely. So that should not happen. So we should to treat individually. That child also demands respect. It is his right, and he should be heard, and we should not be judgmental about this. And these are the certain examples. Do not assume a person with a disability either wants or requires assistance. Never feel that, oh, he's disabled, let me help him out. So ask him whether actually requires help or not. Okay. Sometimes they are very much able. They want to do everything on their own. So it is decency and courtesy to ask, do you require help? Can I help you? Do you want help? Instead of just asking them, we just pull their hand and cross them or try to help them as if they require that sympathy, should not be done. So we need to really rethink what are we doing right now and spread the message that these persons who are disabled actually want to have the same freedom and want to be treated equally. So don't do anything without asking them. And rejection of aid is meant as a personal affront or upon acceptance of your help that you know without being told what service to perform. Just you keep on doing without even asking them. And a disabled person is dissatisfied with his or quality life and thus seeking pity. We assume like that. But in fact, they may be very satisfied. These persons may be very satisfied. They may be feeling they're very abled. We all know that they have very extraordinary talents also. So don't offend them, but making them feel that actually they are suffering or seeking help or giving pity to them, which they do not want. They do not want our pity. They want just respect and dignity. That is what we should be taking care of. In the rights of the person, as per Article 3, I know we have to take care and just note this, the respect for inherent dignity, individual autonomy is very important. There should be freedom for every person, including the Down's child or the Down's personality, to make his own choices. And that is very essential. There definitely should be non-discrimination. There cannot be discrimination, and this cannot be tolerated, especially in today's times. It's already we are delayed, we have to give them the right. Full and effective participation in every activity, whether it's in school or outside school. Inclusiveness in the society is essential. Respect for the difference. They may be different. We have to respect that difference and accept the persons with disabilities as a part of human diversity and humanity itself. Yes, please, we need to make a note of it. And this has to be, this message has to go across all pediatricians and among our forum and outside, and even the community. Equality of opportunity should be given to them, accessibility of help, equality between men and women, respecting for evolving capacity of the child with disabilities and respecting for the right of the child with disability to preserve their identities. Belief in the potential of the person with disability is extremely important. So this is a key message, and this is I would like to just say that ethics while dealing with disabilities are very, very important. And it is very important that our pediatricians should know about all this ethics and should see that they are, first of all, they should change themselves to look at these children in a non-judgmental way. Don't assume they are challenged, they may be retarded, their IQs may be equally good. In fact, they may be better performers. They are very satisfied and they want to be respected and to be treated equal. So don't give them pity, just give them respect and dignity. So they will do their own work. And just we have to, don't write, MRCP and all those things in your prescriptions without even looking at the child or assessing their IQs in OPD. So you cannot assess the child completely in a quick OPD. So give them different time and really assess whether they have any other comorbidities, and encourage the parents. Parents require a lot of encouragement and support from all of us. And we should not presume, as we already said. The teachers also, let us put a word to the teachers to accept them as what we want our pediatricians and society to accept. And this is a very important rights issue that we need to propagate that and support the parents. Very, very important. Breaking the stereotype is what the key, I think that's the game changer or the tagline for this session. So we all think, to treat the children in a certain way. We have to break the stereotype, and society tends to actually look at these individuals with disabilities are less capable or intellectual challenge. This is not the actual fact. So we have to change ourselves and sensitize our pediatricians and the community and the teachers who are dealing with them. And at last, supporting the parents extremely essential. Thank you.
Yeah.
Very well. Thank you, Hema. Should I, as a chairperson, do I need to say something?
Yes, ma'am.
Thank you, Hema. Wonderful presentation and the best. And the
but
best
I'm
part
not an
is,
expert, but try to,
No, you have really flagged off very well a very common issues which need to be addressed related to these little children. It was a good reminder, and so that has made everyone aware that when we are in our clinical practice, we must take into account these little emotional aspects related to these children, because as it is, they feel that they have a low self-esteem. So therefore, and whereas the siblings and other children might be getting more attention. So we really need to look after them and empathize with them and take care of their needs. And empathizing is more important, and rather than labeling anything. That is a very well brought out point. Thank you very much, Hema, for this wonderful presentation, as always.
In addition to Dr. Himabindu's this talk, which was really very briefly explained everything in a very elaborative way. So some additional points on the role of medical ethics of children with disabilities. Just a point, I just want to point out: informed consent, autonomy and reports, non-discrimination, confidentiality, best interest of the child, equitable access, advocacy and support. By adhering to these principles, healthcare providers can help and ensure that children with disabilities receive the care, support and respect they deserve, fostering the health, dignity and inclusion in society. So thank you, Dr. Himabindu Singh, just presenting this topic in a very well manner. Now I request the second speaker. I invite Dr. Second speaker, Dr. Chaya Prasad, who is a super expert in Down syndrome cases. She's a just we can say she's handled so many cases, almost 1,000 cases she has handled. Just I was talking to her about this case presentation now. She told me she has handled 1,000 cases or more than that. So I request Dr. Chaya Prasad to just go ahead with another topic: enhancing parental care for children with Down syndrome. How to improve cognition and make your child functionally independent. Over to Dr. Chaya Prasad.
Thank
Dr.
you.
Sangeeta, just
you.
1 minute. Let us welcome Dr. R.K. Agarwal. He is with us.
Yeah, good afternoon.
He's-
Good afternoon, sir.
Good afternoon, sir. Dr. R.K. Agarwal, sir.
Sir,
any comment you
and
want to just give?
He's always been so supportive. No, he
Yes,
really gives
yes,
us
yes.
the
I know
moral
that.
boosting, no, which is very badly at times required in our forum. Thank you very much, sir. My pranam. Thank you. Thank you for your blessings and for coming and blessing this forum. Thank you.
Hello ji, Dr. Raj ji, namaskar.
Namaskar, everyone.
Yeah, hi. Good afternoon, Dr. Neelam. Nice to see you here.
Dr. R.K. Agarwal.
I've been listening to all, everything. Starting से case से सुना है मैंने.
Thank you, thank you. I think we will just hear from you all in an open forum. Now I request
Dr. Agarwal is saying something.
Dr. Agarwal, do you want to say something, sir?
He's mute.
Yeah, please unmute, sir. We want your blessings. We need your blessings, sir.
Kindly unmute yourself, sir.
He's mute.
No.
So,
Agarwal, sir?
Unmute yourself, sir.
आपकी आवाज नहीं आ रही, sir.
Listen, sir.
Can you make him unmute?
Yes, it's a wonderful program. I derived a lot of satisfaction being here. Okay.
Thank you, sir.
Thank you, sir. Thank you.
Over to Dr. Chaya Prasad.
thank you, sir.
Thank you, Dr. Sangeeta Lodha, and thank you very much for giving me this opportunity for the program on World Down Awareness program. And I would also like to thank Hima ji for being here, and especially Dr. Sangeeta Yadav, ma'am. Madam, thank you so much that you accepted to chair this session for us. Your inputs and your work being in the field of endocrinology is so important with children with genetic problems and their growth and development. And thank you to everybody present over here. So without any further delay, I will share my slides. And is it visible?
Yes.
Okay, just a minute.
Click to full screen mode.
Okay, just a minute. One second. Okay, visible, no, Dr. Sangeeta?
Yes.
Yeah, okay.
Perfect.
Thank you, everybody. Thank you once again. And I would also like to acknowledge the role of Indian Academy of Pediatrics in helping all of us, the neurodevelopmental specialists, to empower us and to support us and guide us all the time, so that we were able to do something better for children with various kind of neurodevelopmental disorders. So going ahead, I would like to say that children with Down, they may be down, but they are not out, and I think they bring a lot of happiness and joy with their presence wherever they are. So today, as I was discussing with Dr. Sangeeta Lodha, Sangeeta Madam and Hima ji, that this talk should be more on the combination of social and medical model, and how the combination of social and medical model can help children not only with Down, but with other kind of neurodevelopmental disorders as well. So starting with Down syndrome, because this is mainly the information that pediatricians should be able to share with the parents of children with Down syndrome. And this program is basically for empowering the parents of children with Down syndrome. And that's why a little revision on what Down syndrome is. And then we will go ahead how enhanced parental care can improve the outcomes in children with Down syndrome, and how parents can help improve the cognition functioning of children as well. So as we all know, Down syndrome, which is a genetic condition, and the three main types of genetic changes that we see are trisomy 21, the translocation, and mosaicism. And we know that trisomy 21 is the commonest. And this trisomy 21, it occurs equally in all ethnic, racial, and socioeconomic groups and religious groups. And just to revise once, that Down syndrome had been first mentioned, the description was mentioned way back in 1860s by Langdon Down, and it was exactly 100 years later that the chromosome was identified, around 1958. So it is that old, and doctors have been working to improve the lives of these children. So as we all know, that prevalence of Down syndrome doesn't really change, but it is influenced by maternal age, and it differs little bit in the population. So it has been seen that it is between 1 in 319 to 1 in 1,000 live births. And definitely we are seeing a reduction in the number in the prevalence as well. So we know that Down syndrome has a high genetic complexity, and there is a lot of phenotype variability as well. And that's the reason also that there are much changes in the prevalence that we are seeing. So trisomic fetus, they are at elevated risk of miscarriage also. And the people have increased incidence of developing various medical conditions, which I will be touching upon, so that pediatricians are able to mention these things to the parents. I would like to mention over here that way back in 2012, when I was working at the Government Institute, I had an opportunity to create a Down syndrome health card. I have it with me over here. And I have been giving this card to all the parents of children with Down syndrome who come to me. This is the card that I had created, and I had mentioned everything from the beginning, that what should be the health problems that parents should be aware of, and what they should be looking for. So right from 0 to 1 month, what all investigations, assessments should be done, and what the pediatrician should look for. Then from in the first year up to 12 months, and then 12 to 18 and above 18. And everything is mentioned over here, how the growth monitoring has to be done, the dental care, the spinal care, the signs for spinal cord compression. And I have been using this Down syndrome card for many years now, and it has helped parents to become aware of what medical conditions their children can have, and they actively intervene even if there is a little bit doubt that they have. Going ahead, so there's been a lot of recent advancement in the medical treatment with social support, and this has increased the life expectancy for Down syndrome population. And the average lifespan that they have is around 55 to 60 years. And as Dr. Kusum Kala mentioned about the prenatal screening also. So the prenatal screening and global demographic trends also, they are helping in identification early. And, although we should not say that it is a burden in the society, but the parents do feel that there is a lack of resources still in our society, and they are not able to reach out for help at every place. Thus, it helps to bring down the numbers as well. So, as we know that the Down syndrome complex phenotype, it definitely results from an imbalance in the numbers, and the trisomy translocation is there. So, what are the risk factors? The main risk factors, and they still remain the same, are the advanced maternal age as well as the consanguineous marriages. Recent study, as I was reading the research papers, they have also shown that some families, in some countries like the United Arab Emirates and UAE, those countries where some women continue to give birth to many children over a prolonged period of time, also may have some children towards the end with Down syndrome, because religiously they believe that they do not believe in medically terminating anything, and they are also saying that having multiple children and over a prolonged period of time also, it increases the vulnerability for genetic problems. So I will not go into detail about what are the phenotypic features, because pediatricians are very well aware about that, but I am going to touch upon what are the common medical health problems and the challenges that children with Down syndrome face, so that it's easier for the pediatricians to know that rather than phenotypic features, it's more important to educate the parents about the medical conditions. So this data has been taken from the CDC and also from the American Association of Pediatrics. So as we can see, and most of the pediatricians, because they are mostly aware of it, 40 to 60% of children with Down are born with cardiac defects. We can see around 75% of children affected with hearing loss. So it doesn't have to be a profound loss or in both ears. It can be a very minor loss, maybe in one of the ears. Many of these children also end up with obstructive sleep apnea. It's not only due to obesity, but it is also because of the structural problems that the children have in their oromotor space and their laryngeal space. Around 70% of children have, they experience ear infections. Around 60% of children face visual problems like cataracts and refractive errors, and they may require glasses. 1% of children with Down syndrome are also born with glaucoma. And, the research says there are around 12% children who are with Down syndrome who are born with difficult intestinal problems, disorders, and they may have intestinal blockage and they may require surgeries. You all know around 6 to 10% of children have hip dislocation, which is identified in the first few months after birth, or sometimes it gets delayed where they may have more of locomotor variations. So thyroid is again a very important, function for everybody, especially for children with Down syndrome. We know that many of these children, around 18 to 20% of these children have hypothyroidism. So it is very important to tell the parents to get the thyroid test done. Most of these children, and as Dr. Kusum Kala was also mentioning about the adolescent that we were talking, that he had anemia. So here we can see that 10% of the children have around the iron deficiency anemia, and it's very important to inform the parents about the supplementation, iron supplementation that is required, and what changes to make in their daily food routine so that they are able to maintain. It's not only about supplementing, but it is also important to maintain that iron level. We have seen that children who have a low iron content also have attentional difficulties. And because of the attentional difficulties, either they are not able to perform well in academics, or they are remaining irritable or having anger issues. Around 1% of children with Down syndrome, they may experience leukemias during the early childhood period, and 1% of children also experience the Hirschsprung disease. Now, I would like to mention a few words about the brain morphology. So we always wonder that why children with Down syndrome are having these cognitive difficulties. Over the periods, in my experience, I have seen that there has been a dynamic shift, and children with Down syndrome nowadays, they have better cognitive abilities, better adaptive abilities. But then what it is that it is making them difficult to apply their cognitive abilities for day-to-day life. So these studies were done way back where they showed that through the various imaging techniques and MRIs, they found that children with Down syndrome overall have smaller brain volumes, and the greatest discrepancy was actually seen in the frontal lobes, brainstem, and the cerebellum. So probably this is also the reason that despite a lot of efforts and therapeutic interventions, their cognitive abilities are not able to go beyond what we expect it to be. The findings also pointed out that some brains also have disproportionately greater gray matter volume and a smaller cerebellar volume. So these are the places, that children will not only require, help with their day-to-day planning, organization, with their memory, thought process, and all those things. And that is the reason they're not able to coordinate well for themselves, and they require a constant support from their family. So these abnormalities from an early age can explain why the cognitive and developmental deficits are there. So now let's talk a few words about executive functions. अब जब हम एग्जीक्यूटिव फंक्शंस और सेल्फ रेगुलेशन की बात करते हैं इन चिल्ड्रन विद डाउन सिंड्रोम, ये जो चीजें हम अभी बात कर रहे हैं, ये मेनली पेरेंट्स को पता होनी चाहिए. द पेरेंट्स मस्ट नो अबाउट दिस, that what are the executive functions, what are the self-regulations, how they can be taught to their children with Down syndrome, and of course with other kind of neurodiverse conditions as well. तो अगर हम सेल्फ रेगुलेशन की बात करें तो सेल्फ रेगुलेशन इज समथिंग जो अर्ली चाइल्डहुड पीरियड में ही डेवलप हो जाता है. इट डेवलप्स वेरी अर्ली इन द अर्ली चाइल्डहुड पीरियड, बट एक्सपोजर टू स्ट्रेस एंड ट्रॉमा ड्यूरिंग द अर्ली चाइल्डहुड पीरियड, it may result in an inability to regulate their emotions. I have also seen in my experience that if there is a child who already has some weak genetic potential and is not getting enough stimulation from the environment, or has been separated from the mother very early because she has to go back to work, these are the children who present with something. I will share an example that I had a child, 5-month-old baby. Mother called me and she said that probably the baby has autism. And when they got the baby to me, 5-month-old, yes, it was seen that this baby was not giving a good eye contact to the mother. And then after taking the history, while I was observing the baby all the time, and because the baby was only 5 months old, I said, let me see if I can stimulate this baby. So I took the baby, I sat with the family in one corner on the floor and started playing with the baby. It took me nearly 55 to 65 minutes to arouse the activity of the baby, and the baby started looking at me and started smiling and started laughing, and the mother was in tears. She said that this is what was missing since 1 month. The baby has stopped giving eye contact. So the baby started laughing and cheerfully interacting with the father and with the grandmother as well. But when I handed over the baby back to mother, the baby refused to do eye contact, refused to laugh with the mother. Again, when the baby was given to the grandmother and father, the child was interacting very well and laughing, but not with the mother. So I was very confused that why this is happening. And then mother told me that when the baby was only 4 months old, I joined back work. So I would come back very late in the evening, and she said, I have noticed since then that this baby is not responding to me at all. So imagine the self-regulation and emotional interaction is developing so well in the early childhood period. It's very important to tell parents to devote enough time, because this will help a good development of cognition and intelligence in children. because without good emotional stability, there is no use of IQ. IQ is not important. We all know EQ is important. So emotional quotient has to be good. Going ahead to the next thing, that there is a very good relation between self-regulation and language development also. Okay. So children who have better self-regulation, they are able to develop better language skills. So language will then facilitate the mental organization, representation of, all the things, adaptive abilities in the environment. So that is important. So हम क्यों कहते हैं कि बच्चों के लिए ये बहुत जरूरी है that parents are spending enough time with their babies in the initial years, because जब ये executive functions अच्छे develop होंगे, the babies will be learning from their environment and within themselves as well to have a good attentional control for the activities that they do. They should know where we have to stop, what are our limitations, where we have to respond, what is our memory, working memory. Working memory is very short. A child is playing with the blocks. The working memory will only be for 3 to 4 minutes. But if the parent doesn't know and the child is just jumping from one activity to the other activity to the third activity, this child may end up with some inattentional problems when he goes to the school. So parents should know that they are to play with their children, they are to pay attention to the attentional abilities of the children and help them to understand and use their intelligence practically. So going ahead, a few things that parents should know. So let's talk about the importance of parental care over here, because they play a very crucial role in the development of cognition, social and emotional development. So first of all parenting practices have to be positive. Hima ji, Dr. Sangeeta Lodha, Bhave madam, Dr. Sangeeta Yadav madam, and Dr. Neelam Mohan, we've all done this parenting program earlier, and we've spoken so much about positive parenting practices. So here also it stands very true that parents should be able to foster a supportive environment which promotes independence for children, which makes them confident, which gives them a good self-esteem. So there has to be a very assertive approach. So what I did was I put these some words in Hindi also, कि अपने बच्चे को ये बोलने के बजाय कि तू निकम्मा है, तुझे कुछ नहीं आता, तू ऐसा ही रहेगा. Instead of that, there should be an assertive approach and we should be able to use positive words with our children. कि आप में अच्छी ability है perform करने की. You have a talent, maybe it is a hidden talent, but we will work towards bringing your talent out. Your work is commendable, चाहे वो छोटा छोटा काम करें. Your work is admirable. You have done enough efforts. I am proud of that. तो ये वाले जब हम words use करते हैं तो बच्चे को एक एहसास होता है that I am being accepted within the community, within the family first and then within the community. That is very important for the parents to use these words. And of course, Dr. Hima ji already mentioned, that mentally challenged, mentally retarded, all these words actually should not be used by anybody in the society. These are all very derogatory remarks and they should be totally avoided. So parents have to take care not only of the physical home environment, which includes the toys and learning material, but also the cognitive home environment. Down syndrome के बच्चों को they might understand what is going on in their environment, लेकिन अगर उनके आसपास quantity and quality of language is not good, they will not be able to learn enough from their environment. And the degree of parental responsiveness is also very good. Sometimes parents are so busy, they have to work on the laptop, they have to be busy on the mobile, they have to be busy everywhere. But whenever the child approaches for some help, and if the parent immediately responds with a good warmth and, with a good cheerfulness that yes, I'm here to help you, then the child will remain emotionally stable. He will have trust formation that yes, my parents are available whenever I need, and he will not do a lot of attention seeking behavior all the time, pulling the mother when she's talking to somebody, or pulling the phone, or trying to cry, or throw a temper tantrum whenever mother is busy. So these parents have very important role over here. Another thing that we have seen over the years, that there definitely is an advancement in the parental care for children with Down syndrome, because we know now, the stigma is not there. They are not keeping these children at home. They are bringing them out. Early intervention programs hain. There are very different educational approaches, and all these things are helping these children. Parental support groups bhi hain, and they are able to share their feelings, and they are able to learn from each other as parents in these parental support groups. So this also has helped the parents to, bring about an advancement to help their children with Down syndrome. But pediatricians play a very important role in giving them the correct information. What is missing mostly is giving the right information, the correct information. Information कहीं से भी मिल सकती है, Google पे भी बहुत information available है, but an authentic information that pediatrician will give will definitely help. So activities at home, what parents should do, activities at home should be tailored to enhance the cognition and to improve memory in these children. So here I'm going to tell some points how the cognition can be improved. So first, there should be some structured learning games at home. I always tell parents कि अगर बच्चे की लैंग्वेज भी पूरी तरीके से अभी डेवलप नहीं हुई है और बहुत सिंगल वर्ड्स ही बोलता है, उसमें भी मिसआर्टिकुलेशन है, स्टिल यू कैन प्ले वर्ड गेम्स विद योर चाइल्ड. फॉर एग्जांपल, मदर एंड चाइल्ड इज सिटिंग. So mother can say, okay, you tell me names of 2 wild animals. I will say names of 2 wild animal. Even वो अगर अपनी broken language में बोल रहा है, he should be appreciated for the effort. The mental vocabulary will increase and the word searching in the brain will increase, and also it will help in the memory. Sometimes what mothers can do, they can show 2 flashcards for around few seconds and then hide and then ask the child, what was it that I showed you? So this way the visual memory will also improve. The mother can tell the child name of 5 items which are there in the room. She can say there is a bucket, there is a glass, there is a water bottle, there is a hairbrush, and there's a table. 5 things. Now tell me what were the 5 things. So the auditory memory will improve. Once the visual and auditory memory starts improving, the child starts, using the cognition in a way that he becomes aware of his environment, memory improves, and he finds academic also interesting. Another very important way is reading and storytelling. In the year 21, when Dr. Piyush had got out the national guidelines, I had the opportunity to write about pre-reading skills in children and what is the importance of reading. So reading should be started to children at a very early age, especially children with Down syndrome, because reading will help them for identification of items, the pictures that they are seeing, identification. और एक बार अच्छी identification हो जाती है, तो language centers will stimulate the other organs of speech to even speak those things until and unless there is a speech and sound disorder. So a simple functional language delay can actually be helped by all these things, by reading and storytelling. Memory recall is very important. Sometimes, I tell mother, आप एक छोटी story बनाइए 5 sentences की. You tell 5 sentences, 1 story daily to the child. And then on the 7th or 8th day, you miss the sequence. You change the sequence and see whether the child gets alerted. Oh, the sequence has been changed. And he should be able to stop the mother that, no, you're saying something wrong. So even that memory recall of the story will help build a good imagination and a good language search in the brain. So that really helps the children. We all know children with Down syndrome, they love music, they love dancing, they love all those rhythmic activities. I have read research papers which says that if children are doing good rhythmic activities such as dancing, so then their language also gets enhanced, because motor and language neurons, they build together. So it will not only help them in their language, it will help in cognition also. So just imagine a thing like dancing can help in language and intelligence and in motor activities, all 3. So we should encourage children for these things. We know that they might not be able to do so well in reading and writing, but that is okay. Once they are told that they are doing very good in music or dance or something, at least their self-esteem will be higher. Physical exercise, movement, of course, is very important, which promotes coordination, balance, and motor skills. Creative arts and craft is also very important, because children with Down syndrome, they actually find these things very important for their expression. So creative arts and crafts opportunity should be given to them more. There should be opportunities for sheltered social interaction. अगर हम एक बच्चे को जिसको डाउन सिंड्रोम है या उसका लैंग्वेज में डिले है, if we leave him with a group of peers who are very smart and interacting and doing their own games, now this child will not be able to understand the rules of games and all those things and may feel left out. So if it is sheltered, if there is an adult person who is also participating and helping this child to participate, then everybody will understand that yes, this child takes little longer time to understand, so they will also take that child along. But some sheltered environment has to be there so that everybody is able to understand the pace at which they have to work. So it really helps them improve their self-esteem and cognition. Outdoor exploration and nature walk is very important. So every year हमारे यहाँ जितने बच्चे आते हैं therapies में, we take them out to nature walk. Chandigarh has a new bird park now, and the last that we had taken them, no, it was to a garden again, but the bird park was something that children really enjoyed. So a lot of greenery and birds and everything. So this also helps them build their self-esteem and all their senses in the outdoor environment. It helps them coordinate their neurons better and helps in their memory and their language. Another thing that I always tell parents is that if your child is not doing anything, वो कुछ भी नहीं करता है, कुछ भी नहीं सुनता है, कुछ भी नहीं आपकी instruction follow करता है. One thing I tell them, keep the child with you when you're doing your routine home-based work. Working in the kitchen, washing clothes, drying them, picking them up, folding them. So, you know, what happens is that already a child with Down syndrome, he's having hypotonia. He's already having poor motor coordination. He has a poor language. Now, if we make him sit in one corner and don't allow him to do anything, this is a child who will absolutely feel left out. So it's very important that some or the other activity keeps on going on at the house so that the cognitive and perceptual activities develop very well. One thing I tell mothers daily is that play hide and seek with your child. Hide behind the curtain. Let the child search for you. He might show your feet from below the curtain. Let the child know that, yeah, mother is there. But still give him the joy of searching you and let him enjoy that thing, you know. So these little things, activities, and, you know, combining all of these activities, all of the play activities, making a routine, structured environment for the child makes the children feel more comfortable, and they trust that yes, this is the next activity will be there. उनकी anxiety कम रहती है. तो it is very important कि एक consistency उनकी routine में रहनी चाहिए. So it now I think a few last 2-3 slides only, that it is essential to tailor all the activities to these children's interest, ability, and their developmental level, because this will help them to get involved and engaged in these activities, and thus it will provide plenty of encouragement, positive reinforcement, and support through this learning process that parents do. And involving parents in implementing all these activities at home further enhances the effectiveness in promoting the cognition development. तो ये जरूरी नहीं है कि सिर्फ एक सेंटर पे going 1 hour in getting the therapy done and everything will be fine. No. Parents have to be a part of this team as well, and they have to play their role very well. Pediatricians must acknowledge the challenges that parents are facing. Parents' mental health is also very important. Pediatricians must reinforce again and again the importance of yoga and meditation and walks whenever they visit the pediatricians. And it is important that pediatricians take the parents along, for the advocacy, because parents' voice is important. They know best what problems their children are going through. So it's very important to keep them. This is some healthcare information which is available online. This is just one page, but this healthcare information for families of children and adolescents with Down syndrome is available on the website of American Academy of Pediatrics. So this is the last slide that pediatricians, all pediatricians, you please pledge to carry out the responsibilities dutifully. Number one, to promote the rights and inclusion of people with Down syndrome in the society. Number two, to provide the right information, support, and resources to people with Down syndrome, to their families and the professionals who work with them, to promote and advocate for positive attitude towards persons with Down syndrome, like Himaji already mentioned, and to create awareness about the potential of these people. And they should be treated as valued members of the society, and also to empower the persons with Down syndrome for living a very satisfying, hopeful, and living in conditions that they feel comfortable and they also feel secured. I would like to share with you that when I was at the Government Institute over here, my professor in the psychiatry department, Dr. B.S. Chavan, he's no more now. But with him, we had started the Chandigarh Down Syndrome Society. Or sir would always say that what will happen to these children after their parents are no more. And he wanted to create a kind of society, a city where these families can come and stay together and help each other's children, whoever is there. Unfortunately, sir is no more now. But yes, his work is being continued by his team. So I stop over here. Thank you very much. And one thing I would like to say, that we cannot always build the future for our children, but we can build our children for the future. So thank you very much for giving me this opportunity. Thank you.
Very well explained and detailed given by Dr. Chaya Prasad. Dr. Elizabeth and Dr. Sangeeta Yadav madam are here to chair the session. So I request Dr. Elizabeth madam to give expert comment. And after that, I will request Dr. Sangeeta Yadav for her expert comment. Then this forum will be open for all. Over to Dr. Elizabeth ma'am. Madam, unmute yourself. Unmute yourself. Madam, unmute. Yeah.
Okay. So this is a wonderful day that we are having the curtain raiser. But for WPF, who would have mentioned all these things? That the hidden points from Dr. Chaya Prasad, she has not left any stone unturned. And Dr. Himabindu, Dr. Kusum, they were giving excellent views on Down syndrome, which we have never heard so far. So that is it. WPF is giving us the opportunity. And I'm very happy to welcome R.K. Agarwal sir to our midst, along with all our WPF officials and the chairpersons and the panelists. So I have 3 points to say. These are life stories I'm going to tell, no theory. That is, one thing is this was highlighted that we should have concern and empathy for the child and the family. I think the best example I can quote is Dr. Shaji Jacob from Kerala. Tomorrow in the IAP, the IAP platform, Central IAP, he is the chief guest. He was the national president of the Down Syndrome Society. Now he's an international figure. And I have seen him bringing his child all throughout during all the Kerala conferences. And she is a celebrity now. She goes to Middle East, to Australia, to Europe, and brings medals. And how they have mentored that girl beautifully to this achievement level. So one of our pediatricians is there showing us the best example. So I think we must give them hats off to them and give them a big applause. And we must celebrate them, how the family they are seeing. And the second story I want to say is that a mother came and asked, why my child is different? And why are you calling him Down syndrome? Is it because he is down in growth and development? So I said, no, Baba, it is because of the John Langdon Down. He described this disease. That is why this issue. That is why the name is down. It is not because any one of us think that these children are down. I think we have to clarify this. Some others are reluctant to ask you. And then why my child is different? Then I asked her, I looked into her eyes and asked, who is your favorite god or goddess? And he said, it is Ganapati. Then I asked, why Ganapati is so unique from all the goddess and gods and goddesses? And then she thanked me and said, now I understand. I understand. This is a very special, unique creation. And then the third one mother came and asked, why we are having this baby? Nobody else is having in our family. Then I said, this is a special creation of God. And they are loving. They are trainable. And they have a lifespan. They are the best among all the mentally challenged children, no? They find out the special ability in your child. There is a special ability hidden in your child. You will have to find it out. And then many mothers speak out and say, I have realized keyboard is his unique feature. I'm going to train him in that. And so why me? Then the creator looked at all the parents and he chose you particularly to look after the special creation. She was also so happy. And she said, this is what I wanted to hear all life long, but nobody told me. Yes, we can do wonders with this kids. Thank you for this great opportunity. And all the panelists have been wonderful, bringing out all the hidden aspects and a very unique approach to this. Thank you very much for allowing me to chair this session and give my comments or my experiences with you. Thank you.
Yeah. Thank you, Dr. Elizabeth, madam. You have given wonderful example, really appreciable. Now I request Dr. Sangeeta Yadav, madam, to just give her expert comment. And then this forum will be open for all. And I have received 3 questions during this session that I will just put after the expert comment from Dr. Sangeeta Yadav.
Thank you very much, Sangeeta, and congratulations for this envisaging a wonderful program and everybody who is there part of it. And Himabindu and Chaya's presentations were superb and really to the point. And before I give my comments, I am very glad and to be on this forum with all of you. And we really look forward the way you are taking this whole program forward. Earlier, Himabindu was there, and now you are there, and we are all part of it. You have made us all part of it. I'm very happy about it. Thank you once again. Now coming to Chaya's presentation, it was excellent with her experiences, which she has shared from her unique center. She's doing fantastic work. I've been to her center and I have seen how the whole team is dedicated towards it and how they plan out, with some innovative ideas. I've been there. She beautifully highlighted the comorbidities which are part of it, and we all need to have a multidisciplinary approach, and as a team we work. Like I know in her center there is a wonderful team which is there to address these issues. Yes, hypothyroidism is an issue, and if we address the hypothyroidism and we screen them, definitely it makes little difference to the IQ or the DQ points related to these children. So we must address it. Like she was saying, anemia has to be taken care of, another very common comorbidity for these children. And of course, the visual and the hearing and all these need to be addressed. And very nicely she had elaborated and explained about the brain of a Down syndrome child and the development and how it correlates with the neurological events, issues and the events which are part of the Down syndrome. So there has to be an understanding for that so that we can address these issues related to the Down syndrome. Yes, I know about Dr. Shaji Thomas, his daughter, who has been with, I have met in some of the forums. There are many children who are lucky who get addressed and they reach you and we take care of them. And very nicely, Chaya has flagged off how we need to look after them. but there are some who are really at the periphery who may be abused. That is also there, and they do get abused physically and otherwise. So we have to explore, we have to ask, so that we can address the issues which they are not talking about. Their own siblings at times, they bully them, they abuse them. So we must take care of them. And Himabindu very nicely brought out that they also have certain rights. And in fact, the whole family has to be taught as to taking care of these children. They are special children and they really need to be taken care of. Thank you very much. Thank you, Sangeeta, for having given me this honor and opportunity. And it is always my pleasure to be with you always. All the
Thank
best
you, Dr.
for
Sangeeta
future
Alota, madam, for your
programs.
expert comment. The 3 questions I'm going to take, and after that, one small video which has been prepared by Dr. Chaya Prasad. Dr. Pallavi, Miss Pallavi will play over there. And after that, we will open the forum for all. One question was that what is HALL criteria, HALL criteria? Dr. Chaya Prasad, Dr. Himabindu, or Dr. Kusum Kalla, anyone can give answer to this. Hello, madam, unmute yourself. Dr. Himabindu, please unmute yourself. Hello, Dr. Himabindu. Oh, second question.
Hima, unmute. Hima, unmute.
No. Anyway, I'll call her. But the second question is, can male with Down syndrome can plan for kids? Dr. Chaya, can you just give answer to this question?
Yeah. So, this again falls into the same protocol that they should go through those series of investigations, and the prenatal screenings are there, because more than just looking for the chromosome, we have to look for other comorbid conditions that must be there. So it's very important that the person goes through a series of assessments before a person with Down syndrome wants to even go in for planning an offspring. So that's very important. And research does say that there are, these percentages. There is the prevalence that they will have around 13 to 20% of these people will have offsprings which will have these genetic mutations that will be there. So it is always important that proper genetic counseling is done, all investigations are done, because this is actually a problem, not a problem. This is actually a question of the human rights. And if a person wants to get pregnant, so the pros and cons have to be informed to them. And then it is their decision and the family's decision for them to go ahead.
I will request Dr. Puhun to give her observation, what he observed coming to India.
Yeah, I think, can I speak, Sangeeta?
Yes,
I was
madam.
sorry.
Yes, madam. The question is for you only. What is the status of informed consent for differently abled patient about 18 years of age? And
Status of informed consent.
Yeah. Yes. Over to you, ma'am.
So yeah. No, after 18 years, they're all adults, and we have to give them informed consent, whether it is able or, as we said, these are only special children. They have very good IQ, and they can understand what's happening with them. We should respect the individuality and definitely take a consent from them. Dr. Chaya can add, she's just raising her.
Yeah. So one thing I would like to mention over here, that children with Down syndrome who have these intellectual disabilities especially, they have to obtain the guardianship certificate from the National Trust. And because either a parent or a very close blood relative is deputed as the person who will take their decisions. if they are having difficulties, and mostly we have seen that they might have difficulty taking their decisions. So the guardianship certificate has to be obtained from the National Trust, and then it can be discussed out that who are the people who are taking the decisions for them. And
For that, all children are only, I think that is only for those who have difficulty, and we have to assess them properly. If they have any
this is for all, this is for all children. All children, especially who fall in the category of intellectual disability. So it may be along with Downs or fragile or any other related thing. All children. So mostly Down syndrome, of course, they also.
Sangeeta ma'am, there was one question regarding Hall's criteria.
Okay.
Actually, these are the physical features, total 11 points we see.
Yes.
Out of that, if 4 or more are present, there is strong suspicion of Down syndrome. If not diagnosed antenatally, we can send karyotyping for that child, which includes simian crease and brachycephaly, low set ears, folded ears, and decreased gap between the toe, the grade 2 and the first toe, and few others.
Thank you, Dr. Kusum. Now I request Ms. Pallavi to play the video which has been prepared by Dr. Chaya Prasad madam, and it is her own practical video, we can say rather, how beautifully she has carried out this video. After that, Dr. Smita from Delhi, she has wrote a poem on this Down syndrome kids, which actually Dr. Madhuraturi has given the chance to read, but now I think she has joined the webinar. So I will request after that video to Dr. Smita to read that poem. That's a really very beautiful poem she has wrote.
Please, Dr. Sangeeta, please carry on. I will just love to listen from Dr. Madhu.
Okay. Pallavi, will you please play that video which has been prepared by... Thank you.
He's trying to teach me. This is the child with Down syndrome we are working with. He's teaching me.
हाँ मैं बोलूंगी, आप जैसे बोलोगे मैं वैसे ही बोलूंगी. चीता. अच्छा, आप जैसे बोलोगे मैं वैसे बोलूंगी. मैं बाहर नहीं देखूंगी अभी, नहीं देखूंगी बाहर, मैं किताब में देखूंगी. अच्छा ठीक, ठीक. Big bed. Big bed. कहाँ? वो? ओ, अच्छा ठीक है. अच्छा कहाँ देखो?
Actually, his name was written on my wall. He wanted me to say his name. So we've been working with Manraj for 2 years now. And his cognition has improved a lot, and whenever we meet I try to behave in front of him like I don't know anything, so are you going to teach me something? So whenever he sees me, he's in that mode like I have to teach her something, you know. So he comes out with that potential of his. So thank you very much for playing that. That was just, it was a very informal, casual thing that was happening. So I would myself like to invite Dr. Smita Mishra. It's a pleasure to have here on this platform. And Dr. Smita has been doing wonderful work for children with Down syndrome, and we'll be very happy to hear something from her.
So, Dr. Smita, over to you. Dr. Smita. Dr. Smita, are you there?
Yes. So, Dr. Sangeeta, I am in US actually. So that is how it is. You just hold on. I have to look for my poem where it is. But I really wanted to tell Dr. Chaya, thank you. We actually thought of a Down syndrome home care program where mothers can be trained to train. Can you listen me?
Yes, yes.
Can you hear?
Yes, I can hear you.
So a program actually I tried to make from the JP hospital when I was working there in 16-17, and because we could not culminate in successful program over there, then we got an opportunity to go to Bhopal, the capital of Madhya Pradesh, and we had a very supportive administration. So the whole state was actually shaken, and the people from different center they came, and we had a 2-day session. So that was for the gynecologist and
Recording
the,
in progress.
Yeah, so that was a really very good experience, and Dr. Chaya was one of the our faculty. We also call the parents of the Down syndrome, the educated parents of the Down syndrome, because what I felt that Down syndrome screening is really poor thing in the remote India, because I keep on doing the camp in the remote portion of the India, and I find that people are not even making a diagnosis of Down syndrome after 3, 4, 5, 7 months. And then when they make a diagnosis of Down syndrome and AVSD or some congenital heart defect, so they will say that what they need to go for surgery because baby has Down syndrome. So that is the one thing one should always know, that the AVSD in Down syndrome is a balanced one. So it always, the outcome of surgery is very good. And if you are not operating on time, it is going to convert into within 2 years into Eisenmenger syndrome. And if you created a Eisenmenger syndrome within the Down syndrome group, then you are nowhere, because then your all whatever you want to do for the developmental thing and the teaching about various things. So whatever you want to do, you cannot do anything, because then everything is dependent on the working capacity, functional capacity of that child. Otherwise, because now I am working with the Down Federation Down Federation Society of India with Dr. Surekha Ramchandran, and there are various parental group formed in the metropolis and the many big cities. These are the Down syndrome parental societies. So I am also working with them, and we are giving that annual health camp and the weekly or monthly OPDs online. So now we see the children, because in Down syndrome the IQ is between 30 to 70 in general. It may be high, it may be low, but unless you are giving them a developmental stimulus, you cannot increase the IQ. So that is the biggest part, ki like they should be actually identified early and should be started. Actually, Dr. Chaya, I actually, few of my patients, I push them that go to your center and learn, and then you come back to your own city like Agra, like Jammu, and become a pressure point, so that early identification and screening can be done, and through the Rotary Club, Lions Club, and WhatsApp group. And the second part, that you should not be very disheartened, and treat it as a very special opportunity for yourself, that you are now becoming a leader in yourself, and you should be having a lot of confidence, because the mothers were so disheartened. So these are the things which we keep on doing. And about the poem, Madhu ma'am, do you have my poem?
Yes, I do have. Yes, I do have.
Please read that.
So I either I read it or I share it to you. You read it.
No, you read it. Your voice is so good, you have a very different quality of voice,
I just see I have got your poem. I'll going to read it for all of you.
And thank you, Dr. Madhu. You have been such a great encouragement for my poems.
Yes, I love each word of you.
Smita, very good, Smita.
Thank you.
ठीक होता है.
Thank you, ma'am. Yeah.
Just
Yeah.
Just 1 second. I am bringing it. 1 second.
And Sangeeta, I have
Yes.
sent a photograph to you from that day function. We had wonderful things, wonderful dancers and all, but this was a showstopper for us. Can you reflect it on screen? I have sent you in WhatsApp. I think it will be difficult, but you are now very
Right
technocrat.
now it is difficult because we have to go for open forum for 15 days, but definitely I will share that in all the groups later on after editing. Okay? Yeah.
You are now IT person for us, besides being so many MLA.
Yeah. Over to Dr. Madhuraturi ma'am for this poem, and then if anybody is having a question, this forum
Can
will
all
be
hear
open,
me?
and one by one.
All of you hear me? Should I start the poem?
Yes, ma'am. Yes, ma'am.
Yeah. You all can hear me?
Yes.
Okay. So it is by Dr. Smita Mishra. We are little kids like the colorful flowers. We are little kids like the colorful flowers. So we have different scents and flavors. Don't just judge us from lazy pace of growth, as we have different roads and goals. We may have same eyes, teeth and cheeks, but have different chance to bloom at unlike peaks. We do not lose heart if we fail to win. We do not lose heart if we fail to win. Game makes us joyous and we grin. Oh dear nation, we love you and keep flag high. You know we are wise and know our rights. We pledge to be proud of ourselves too, to stay independent and sail through. We can work for our parents' pride. So let's join hand to end the stereotypes. We are little kids like the colorful flowers. So we have different scents and flavors. Don't just judge us from lazy pace of growth, as we have different roads and goals. Wonderful, Smita. Beautiful each
Thank you so
word. Beautiful.
Very well. You have recited it very nicely. Thank you so much.
Beautifully written. Very good.
Thank you. Thank you, Chan.
क्या बात है मैडम, क्या बात है.
As the said, they may be down, but they are not out. Absolutely wonderful. And I also just want to add one thing, that as everybody said and Dr. Hima was talking, the words have, spoken words have, on your personality, they have impact. You must have all have heard the name of Dr. Masaru Emoto, a Japanese scientist who is doing so much work on the spoken words. His experiments are wonderful. I can share a link of spoken words on rice. He spoken thank you to one, some bad words to other, and the third, he didn't speak anything, just ignored. And after a month, he said thank you to one jar. The rice were started blooming. The other, which he said bad words, were black, and the third one, which he ignored, started rotting. So this is all the parents have the maximum role. Children's no fault. The children who are Down syndrome, they have no fault of themselves. Only the parents can help them bloom. That is very, very important. That is all I have to say. Thank you so much. Wonderful by each and everyone, all the speakers.
Thank you. Thank you so much, Madhu ma'am.
Thank you. So I think I'll just ask if Dr. Gunjan's phone is working. 1 second.
Is Dr. Gunjan there? So I thank all the august people who are present here and all the speakers, Dr. Chaya, Dr. Himabindu, Dr. Kusum Kalla. They have done their job very meticulous, informative and enriching.
No problem.
Thank you so much, Dr. Sangeeta Yadav and Dr. Elizabeth, for your practical insights into the matter. And Smita, cake, icing on the cake, your expertise. You are, Chupa Rustam. तुमको भी आना चाहिए था बोलने के लिए. But I know we had a talk 2 days back. You are there at USA, I know, with your daughter. So thank you so much, all the speakers and moderator, Sangeeta Loda, as well as Gunjan. You are doing your job wonderfully, definitely. Madam was saying that we are all together in Women Pediatrician Forum. That is the strength. Together we can. That is the thing. Thank you so much for this wonderful evening. And thank you all the viewers who are present here. Without
Well
them,
done,
no.
Sangeeta, Dr. Sangeeta. Sangeeta is actually a very dear friend of mine for years.
Dr. Chaya, your talk was so graceful. I think we should keep this talk in Hindi language to all the parents of Down syndrome. Here is a one school where I think almost 200 Down syndrome patients across the Nasik district are there. So can we just keep one Zoom talk in Hindi language for them?
बिल्कुल बिल्कुल आप यूज कीजिए प्रेजेंटेशन को जैसे यूज करना है. If you want me to talk, I'll talk. You can also talk on that presentation. And I have one in Hindi that I use for parents of disabilities when I go to the government schools here. हमारे यहाँ भी Smita ji knows we have a group of 200, more than 200 families of Down syndrome, and every year we hold good programs for them. Some annual sports are there, dance, music, and now the parents know that there's going to be a program. So just 2 days before, they just start calling, where do we have to reach? Even if the program is starting at 11 o'clock, 9 o'clock, they will be there, that we are waiting here. You tell us what help is required, and they'll help to set all the things. And also it's happy to see them, integrated in the community. I know we should do this more often, not just once a year. It should be more often, that they should be made to feel like a part of this society. Yes.
Okay, ma'am. One of the patient of Down syndrome, who is I think 16 years old, has won gold medal in at India level, national level, madam.
Very
So
good.
it is really,
We are having good